Hello friends, this is Dr. Akanksha and I am back on my YouTube channel after a really long gap. As you all know that PG life is really very busy and I really could not put my content on time. Yet I am really surprised with the kind of response I am getting on my previous YouTube videos and your messages on my Instagram. So I'm really thankful for all your support till now, and today's video is based upon your suggestion. So the topic of my today's video is how to start your NEET MDS exam preparation from third year itself. So without any delay, let's get started. So basically, to get through your third year BDS, you have to write university exam of 3 subjects, that is general medicine, general surgery and oral pathology. And let me tell you about NEET MDS exam. It is MCQ based exam and consists of total 240 questions, among which look at the subject wise distribution of subject wise number of question distribution. 14 question comes from each subject, but from general medicine and general surgery 15 question comes. So we can say that the subject that we study in our third year BDS are relatively more important. So plus you have oral pathology to study in your third year BDS. So about oral pathology, it is one of the vast subject that is to be studied for your NEET MDS exam. If you study your oral pathology very well, then oral pathology also covers some part of oral medicine, some part of oral surgery and to an extent some part of perio also. So basically the subject that you study in your third year BDS plays a very important role for your NEET MDS exam. Plus you just have to write university exam of 3 subjects. So you can really start preparation for your NEET MDS exam from your third year itself. So let's begin with our dental subject, that is oral pathology. So for oral pathology you have to refer Schaeffer's, that is standard textbook for oral pathology, and textbook reading is really very important because sometimes what happens, the images that are given there in your textbook that directly comes in your exam as picture based questions. So reading textbook is really very important. And from your third year BDS, what all you can do, you have to understand things. You have to understand what all are different developmental disorders, various benign and malignant tumors, various cysts, various pre-malignant and malignant conditions, various pulp and periapical pathology. You have to understand all these concepts. Understanding is more important in oral pathology because in any entrance exam there is nothing like the question that you study from your MCQ book that will come as it is in your entrance exam. No, it's not like that. You have to understand things, you have to apply things and you have to come to the answer. So I will say that rather than rushing into solving MCQs, you have to get familiar with the various pathological conditions that are there in your textbook. Plus you have to maintain your histological record book in your third year BDS. You have to draw diagrams. So don't draw them as if you have to complete things. Draw them, and while drawing them you have to draw it with understanding. Understand what all types of cells are there. For example, you are studying salivary glands, then study what all cells are there, what is function of serous cell, mucus cell, what changes that takes place in those cells, what are their features. So these all things are very important because in this kind of exam you have to practically apply your knowledge. So I will recommend that you have to emphasize upon understanding things in your third year BDS. Now let's talk about general medicine. So as I already told that general medicine is one of the important subject that is to be studied for our NEET MDS exam. So it does not mean that we should study general medicine from their standard textbook like Harrison's or Matthews. No, it's not required. For us being dental student, it is expected from us that we should know basic disorders from each system, and for that purpose Tripathi is the textbook that is enough. So we studied general medicine as different systems. So from different systems it is expected from us to know basic disorders, their pathology and their management part. So from GIT we should know what is jaundice, what is hepatitis. Then from CNS we should know what is Parkinson's disease, facial palsy, epilepsy. From CVS we should know what is cardiac cycle, myocardial infarction, heart failure. Then from endocrinal system we should know what is diabetes mellitus, gout, thyroid disorders. From infections we should know bacterial, viral, fungal infections, and what all are their clinical features, what is their management part. Then among hematology we should know what is anemia, their different types and their management, thalassemia, what is hemophilia, and similar that management part. Then among respiratory system we should know bronchial asthma, pneumonia, COPD, tuberculosis. Then among renal system we should know what is nephrotic syndrome, nephritic syndrome, and renal failure. So among all these systems we should know basic disorders, and for that purpose our simple Tripathi like dental textbook of that medicine is enough. Plus if you are unable to understand these all basic concepts of medicines from your textbook, then you can always watch YouTube videos of particular disorders, short videos. You can always go for them. There are really very good videos on YouTube of general medicine, so you can really go through them. And once again I will say that understanding medicine is more important than solving MCQs, because as I already told in oral pathology, again in general medicine it's like no question will come as it is from your MCQ book. So for solving the MCQs that are there in your exam from general medicine, you have to apply concepts. So understanding concepts is more important for then. So from your third year you can understand various things from general medicine. That is expected from you. Now about general surgery. So again for us it is not expected to study general surgery from their standard textbook, and we can study general surgery from simple textbooks like Manipal, and that too dental Manipal is like concise and enough for us. We should know basic surgical concepts of various various thyroid disorders, various salivary gland disorders. We should know if cleft lip and palate, surgical management of cleft lip and palate. So we should know the names of surgeries that are carried out to treat cleft lip and palate, and timings of carrying out those surgeries, rule of 10 and all you should know. Then various fractures. Then among basic surgery, ulcers and swellings you should know, various types of ulcers you should know. Then again burns is the important topic that is there in general surgery. Fluid resuscitation you should know in burns, and in burns there are like rules of Wallace and all that you should know. And instruments are very important. They comes as picture based questions in our exam, so that you that also you should know. And again I will say that in your third year BDS it is expected to understand general surgery, and it's not like to solve MCQs and all, but understanding is more important. Now once you understand basic concepts that are there in your 3 subjects that are there in your third year BDS, you can start solving your MCQ books, or you can start solving MCQs simultaneously also if time permits. But again I will emphasize on the thing that understanding these 3 subjects is more important than just solving MCQs. Now about MCQ book, it is recommended that you should have your latest edition of Dental Pulse while you are actually appearing for your NEET MDS exam after internship. So if you are okay with buying it again, like from third year you are buying one Dental Pulse and again you are getting your uh, Dental Pulse in your internship, that latest edition, if you are okay with it then no problem, but if it's an issue, then you can use one app from Play Store, that is Dental Pockets app. It is having similar MCQs and you can study from that app also. One more important thing about third year BDS, that your clinical posting starts from your third year BDS. So you perform various basic procedures like scaling and polishing, cavity preparation and restoration, pulp capping, root canal treatment, then complete denture fabrication, removable partial denture, removable appliances in orthodontics, then extraction, simple extractions. So while performing all these basic clinical procedures, you should read your textbooks, read some theory behind these uh, clinical procedures, so that you will be able to understand the applied things also, and it will be helpful in both ways. It will helpful in orienting yourself in your final year BDS, as well as it will help you in your NEET MDS also. So do that. So I tried covering maximum things that I feel you should do from your third year BDS to prepare for NEET MDS exam, and that's it. Study well. All the very best. Thank you.